Hello guys, my name is Vaibhav Hegde and my topic is corticosteroids. So topics to be covered are corticosteroid biosynthesis, mineralocorticoid and glucocorticoid actions, mechanism of action at cellular levels, chemistry of corticosteroid, uses, adverse effect and contraindications. So let's start with the introduction. Corticosteroids include natural glucocorticoid and mineralocorticoid, which are secreted by adrenal cortex in our body. Endogenous glucocorticoid is hydrocortisone, which is also called as cortisol, and mineralocorticoid is aldosterone. So let's see the biosynthesis of corticosteroids. They are synthesized in adrenal cortex cells from the cholesterol. So cholesterol is required for the synthesis of our corticosteroid. Adrenal steroidogenesis takes place under the influence of ACTS, which makes more cholesterol available for the conversion to prednisolone and induce steroidogenic enzymes. So the first step in the biosynthesis is conversion of cholesterol into the prednisolone. This induced by the ACTS, which is secreted by our pituitary gland. The circulating corticosteroid inhibit ACTS release from pituitary as well as CRS release from the hypothalamus, and thus provide negative feedback regulation. So the our corticosteroid, which are synthesized from the adrenal cortex, gives the negative feedback to the ACTH and CRH, so that the more amount of corticosteroid synthesis could be prevented. So let's see the mineralocorticoid actions. The mineralocorticoid's main action is on the sodium, potassium and maintaining the fluid balance. The principal mineralocorticoid action is sodium reabsorption from the DCT in the kidney. This reabsorption of sodium is associated with excretion of potassium and H plus ions. So on the basis of these actions, if there is a mineralocorticoid deficiency in our body, then there will be the hyperkalemia in blood and acidosis due to increase in K plus and H plus ions. So if the mineralocorticoid level in our blood is increases, then it leads to the excess fluid retention and the hypertension. So these are the actions of mineralocorticoids. Let's see the actions of glucocorticoids. Glucocorticoids has the various range of actions. So first action is on carbohydrate and protein metabolism. Glucocorticoid stimulates gluconeogenesis in liver, inhibit the peripheral tissue to use the glucose in the blood, and causes hyperglycemia. And the protein metabolism, it causes mobilization of protein from peripheral. Now second action is the fat metabolism. Fat metabolism, it causes the redistribution of fat from our extremities to the central part of body, which our face, neck, on the shoulder. So it causes the moon face, fish mouth and your buffalo hump. The action on the calcium. So glucocorticoid causes inhibit the calcium absorption from the GIT and also causes more excretion of calcium from the kidney. So it leads to the negative balance in our blood of the calcium. CVS action. CVS action, glucocorticoid restrict the capillary permeability, maintain the arteriole tone of the arteriole, and also causes myocardial contractility. CNS action. Glucocorticoid has the slight euphoric action on our CNS system. Stomach. Glucocorticoid stimulates the synthesis of pepsin and SCL secretion in our stomach. Fetal lungs. Glucocorticoids causes the structural and functional maturation of our fetal lungs. Lymphoid tissue and blood cell. Glucocorticoids causes destruction of T lymphocyte. That's why it is used in our transplants and also to suppress the immunity. Inflammatory response. As the it inhibit the lymphocytes, So inflammatory response is also declined by the glucocorticosteroid. So that's why it is the best anti-inflammatory agents we have. Immunological and allergic response. It suppresses the anaphylactic reaction in the short-term basis. So let's dive into the mechanism of action of glucocorticoid at the cellular levels. Corticosteroids penetrate cells and bind to the high affinity cytoplasm receptor protein. This leads to structural change in steroid receptor complex and allows the migration into the nucleus. This promotes regulation, transcription of specific mRNA and regulation of protein synthesis. Effects of corticosteroid are not immediate. Once appropriate proteins are synthesized after the translation, synthesized, the effects persist much longer than steroid itself. So let's see what are the drugs comes under the corticosteroid. Corticosteroids mainly contain glucocorticoid and mineralocorticoid drugs. So in glucocorticoid, we divide the drugs into short acting, intermediate acting and long acting. Short acting contain the cortisol, intermediate prednisolone, methylprednisolone, triamnisolone, deflazacort. Long acting is the dexamethasone, beta-methaxone. So let's see what comes under the mineralocorticoid. Mineralocorticoid contain desoxycorticosterone acetate, fluorocortisone and aldosterone. So relative activity of system corticosteroid. So from this side MCQs are commonly asked. So let's see this side. As we know, glucocorticoids are divided into short acting, intermediate and long acting. Short acting means below the 12 hours, intermediate means 12 to 36 hours and long acting means they acts above the 36 hours. So here I will discuss the MCQ points. So hydrocortisone or corticosteroid it has both glucocorticoid and mineralocorticoid action in 1:1 ratio. Okay, remember that. And we have 4 drugs which have 0 mineralocorticoid actions. So what are their drugs? So these are the triamnisolone, deflazacort, dexamethasone and beta-methaxone. Okay, and we have one more drug which has mineralocorticoid highest action, and that drug is aldosterone. That drug is aldosterone, which has highest mineralocorticoid action. And here we also give the dose required for the action. So from this commonly asked question is which is the more potent drug. So from this data we have beta-methaxone and dexamethasone, which is most potent drug among these. Okay, let's dive into the uses of corticosteroids. It is used in acute and chronic adrenal insufficiency. Adrenal insufficiency means there is adrenectomy, there is no presence of corticosteroids at all because adrenal gland is removed. It can be used in various arthritis like osteoarthritis, rheumatoid arthritis, rheumatic fever, and it also can be used in various collagen diseases like systemic lupus erythematosus, glomerulonephritis. It also used in severe allergic reaction because it is used in anaphylactic reaction because it suppresses the immunity. That's why allergic reaction leads to the depression. So it also is used in autoimmune disease. What happens in autoimmune disease? There is our immunity attacks on our cells. So corticosteroids main action is to decrease our immunity. So that's why it is helpful in the autoimmune disease. Bronchial asthma. In bronchial asthma, corticosteroids mainly used in status erythematosus, which is emergency condition. After emergency we withdraw the corticosteroids. It also used in preterm birth. What happens in preterm birth is there is no maturation of lungs of the fetus. So for that corticosteroid help in the surfactant formation and it leads to the maturation of fetus, preterm fetus. So and it also used in infected disease, eye and skin disease. In eye and skin disease, topical corticosteroids are used. Nausea and vomiting is also the use of corticosteroid. In malignancy like lymphoma, leukemia, corticosteroid is used because it has the destructive action on the T lymphocyte. That's why corticosteroids is used in malignancy. Organ transplantation and allograft because it suppresses the immunity. So let's see the adverse effect. So corticosteroid adverse effect is main adverse effect is Cushingoid features, which is moon-like face, buffalo hump, central obesity, fat mobilizes from the extremities to the center of the body. Osteoporosis because it decline the our calcium level from the blood. That is why it leads to the osteoporosis. Redistribution of fat from the periphery to the central. Thin skin because it causes the collagen breakdown. Infection because it decreases our immunity. That's why our body is more prone to the infections. And it also causes the cataract, osteonecrosis because it decreases the blood supply to the our bone. Stress ulcer and peptic ulcer, telangiectasia, visible blood vessel due to thin skin. Telangiectasia मतलब dilatation of the our arteries and veins. Euphoria, psychosis. Next adverse effect is restart the growth, stunting in children. Low potassium because it causes excretion of potassium. Increased sodium because it reabsorbs the sodium. Diabetes due to gluconeogenesis causes hyperglycemia in the blood and suppress ACTS because it gives corticosteroid give the negative feedback to the pituitary gland. So let's the contraindication means in this condition we cannot use the corticosteroids. So first contraindication is peptic ulcer, second diabetes mellitus, third hypertension, fourth viral and fungal infection, fifth is our tuberculosis infection, sixth is osteoporosis, seventh is Hirsch simplex keratitis, eighth is psychosis because it already leads to the psychosis, ninth is epilepsy, 10th is CHF, and 11th is renal failure. So now the topic is over. Let's see some MCQs. So first MCQ is which of the following glucocorticoid have the mineralocorticoid activity. So this is MCQ from that chart, okay, relative activity of corticosteroids. So we saw the one drug which have the both glucocorticoid and mineralocorticoids. And which was that drug? That drug is nothing but hydrocortisone. So the option first is the correct answer. So next MCQ, which of the following is the most potent glucocorticoid? Most potent, we saw the dexamethasone. Third option is the most potent glucocorticoid. Two basically glucocorticoid have most potent action. One is dexamethasone and other is betamethasone. So let's see the third MCQ. The patient was detected to have the moderate infection of COVID-19 disease. The doctor prescribed him long-acting glucocorticoid, the drug most likely to be. So we saw the in the classification, glucocorticoid are classified into short-acting, intermediate, and long-acting glucocorticoid. So what were the long-acting glucocorticoid? One was betamethasone and other was dexamethasone. That's why our answer is second, dexamethasone. Which among the following drug possess highest mineralocorticoid activity? So based on the glucocorticoid and mineralocorticoid ratio actions we saw in the table, our answer should be the aldosterone because it has the maximum mineralocorticoid activity. So I think it is the last question. Let's see. A 34-week pregnant woman present in the hospital for preterm labor. Which of the following corticosteroid will be administered for the fetal lung maturation? So we know that corticosteroids are used for the fetal lung maturation. So what are the answer? Basically this point is not covered by me. I intentionally left that. I want to tell you that betamethasone and dexamethasone, these are the two long-acting corticosteroid glucocorticoids which are used in lung maturation in preterm birth. So that's it. Thank you guys. See you.